So my name is Liz Watson, and I run the Congressional Progressive Caucus Center, and we are here tonight for a really important conversation with frontline healthcare providers and also with Congressman Andy Levin. We are going to give ourselves just a moment to get going and let people in, and then once we've done that, we will get started. So thanks for coming on the call, and we will be getting started in just a minute. I'm glad to have you all joining us. Again, thanks everybody for coming on the call. My name is Liz Watson with the Congressional Progressive Caucus Center. This is our dispatch from the front lines. We are really thrilled to be joined here tonight by Congressman Andy Levin, by frontline healthcare providers who are going to talk to us about just what you're seeing and what you need. And then Congressman Levin is going to talk about what he's fighting for in Congress to make sure that you get what you need to stay safe and to treat your patients. So we're excited to get started in just a minute, and I'm inviting everyone to hang tight with us while we let everybody in. As you may know, Zoom has put in some new protocols that keep us all more secure and slow us all down a little bit, all at the same time. So, so just bear with us here for a second while we get ourselves all onto the call. And on a personal note, for those who are joining the call, I really want to say thank you. I know, you know, this pandemic has been trying for all of us. This week in particular, I think, is a really heavy week for us as a nation, and it sits on our hearts personally as well, very heavy. I know we have family members and friends and relatives who we're all worried about, and I know folks have people in their families who are struggling, who they're fighting for, and to take some time out here to really think about what it is that we can do together to move a recovery forward that puts people first and that really prioritizes making sure that we safeguard our frontline workers, provide people with the relief we need. This is what we've got to do, and for folks out there who are joining us, I'm just so grateful to you, you know, for caring enough to be a part of this conversation and for the work that you're going to do going forward. So really honored tonight to be joined here tonight by frontline healthcare providers who took time out of their busy day, and honored, I mean, the incredible fight that they're in their hospitals every day, and honored as well to be joined by Congressman Andy Levin from Michigan. So we are really pleased to be getting started in just a moment, and please do bear with us. And you might hear my dog Hoagie bark in the background. I want to apologize for that. I hear it all day, but it's kind of the worst. So just bear with us if that happens, and we'll get going. And I heard you might hear Congressman Levin's dog too, so I'll blame it on him if there's a barking dog.
There you go. If you hear a dog, it's Augie. That's it.
Oh, it's Augie, not Hoagie. Okay. Okay, all right. I'm told we can go ahead and get started. My name is Liz Watson. I'm the Executive Director of the Congressional Progressive Caucus Center, and we're having a series of weekly conversations with folks who are on the front lines, fighting on the front lines of this pandemic, frontline workers, and with members of Congress, special guest members of Congress who are fighting to make sure that we have a relief policy that puts our frontline workers first, that puts our people first, and that gets us on a path to a just and equitable recovery. So very honored to be joined here tonight by frontline healthcare providers, by Congressman Andy Levin of Michigan, for this important conversation. And thanks to all of you who've come onto the call and joined us as well. So we all know this, the coronavirus pandemic has swept through the nation like wildfire. It's turned life as we know it upside down a month ago. I don't think any of us could have imagined what is happening. According to the CDC, there are now more than 374,329 confirmed cases in the US and 12,000 deaths. We know that that is likely a dramatic undercount because of the lack of widespread testing. And we know that folks are disproportionately, that communities of color and particularly African Americans are being disproportionately affected, although we don't yet have the real data to tell us nationwide numbers on that. In addition to that, we know that in hard-hit communities like New York, New Orleans, Seattle, and Detroit, hospitals are struggling to care for all of the patients who are coming through their doors, and they're desperately in need of equipment like N95 respirators and ventilators to keep their staff safe and to keep their patients alive. Nurses and doctors are resorting to last-ditch measures like wearing garbage bags, reusing masks, and staying isolated from their families. So that's what we're struggling with here in the United States. And it is a travesty that we have not provided and that our government, frankly, our administration has not stepped in to make sure that every single frontline healthcare worker in the United States has exactly what they need to take care of their patients and to keep themselves and their families safe. It is shameful. And it is making it more difficult in an already incredibly fraught environment for people to do the jobs of saving lives that they mean to do. And we are here tonight to talk about that and what we can do to solve that problem. We're honored to be joined by Representative Andy Levin, who's been fighting for this recovery, and a recovery that puts people first and has been on the front lines of the fight around personal protective equipment. So that's when we talk about the N95 masks and the fight for ventilators and the things that folks in hospitals need. We are also so honored to be joined by frontline healthcare workers who are living and breathing this reality and frankly, this nightmare every single day to save the lives of their patients. So Cathy Kennedy, a registered nurse fighting the coronavirus in California and the Vice President of National Nurses United. Thank you, Cathy, for being on with us today. Dr. Ali Nasrallah, who is the incoming chief resident at Beaumont Hospital in Wayne, in Michigan, which has been converted into a COVID-19 center. And we will also be joined by Dr. Sanjeev Sriram, also known as Dr. America, who leads the All Means All campaign on racial equity and for Medicare for All, and is the health justice correspondent at We Act Radio and the creator of Masks for America. And he's with us tonight to talk about that. We had a bunch of great questions submitted ahead of time, and we'll also take your questions on this call. Please let us know if you have questions. You can certainly put them into the chat. I'm going to start with Dr. Nasrallah. Dr. Nasrallah, I'm hoping you can just tell us what you're experiencing as you're treating patients every day, what you're doing on the front lines of this crisis, and what you need.
Thank you for having me on the show. I just want to say happy birthday to my dad. Today's his birthday. Inshallah, Baba. We'll celebrate in the summer. The experience we're having today is like nothing we've ever experienced, I've experienced in my lifetime, or many of my colleagues. And the experience differs between health systems and where you're located, even within Southeast Michigan. So I'm currently I'm a family medicine resident at Beaumont Wayne, located in Wayne, Michigan, about 20 minutes from Detroit. So for me, our hospital, we're a COVID-only center. We've been dealing with COVID-only patients, which has its pros and its cons. Pros are we can leave the N95 on between patients when we're in a hallway. We don't have to worry about taking the mask off, touching our face, reinfecting ourselves. Those are some of the pros. The staff at Wayne has, and in Beaumont and in general, really uplifts you to work, to come in, they motivate you. And it's all great. There's a camaraderie within it where we feel like we're serving a purpose. But at the same time, we're doing things that you'd never expect to do in medicine, which is reuse a mask, reuse a face shield. These all put you at risk. And then speaking to colleagues, and I have an Instagram page called @thefamilydoc_, and I've been getting messages from people from hospitals in Southeast Michigan and a little west, and I don't want to name them, but it's very, very upsetting what's going on. These residents are messaging me terrified. When I tell you terrified, I mean terrified. They're not being given N95 masks when going into COVID rooms, unless they're doing specific procedures. They're told, this is based on the CDC's recommendation, that unless you're doing a procedure where there could be aerosolized particles, then you don't need it, like intubation, for example, would be permissible. So they're told to use these paper masks. But we're learning every day on the forefront, on the front line, that the management, the information we know, it changes. The way we manage patient, it changes. In February, we were told by the CDC that this is a droplet. There's no worry for contact. Now we know there's droplet and contact. Studies have been coming out this week showing that, you know, it could be aerosolized. It could be an airborne disease as well. Just this week, we're here, the people are told to wear masks in public as well. So until we know for sure, you know, I think we should do our best to protect our healthcare workers, people who are risking their lives. The $3 N95 is not worth my life or the next person's life. So I think we should advocate, we should work together. And when I talk about who's at risk the most, it's our true warriors on the front line, and that's the nurses. These nurses that are going in the rooms hour after hour to give medications, to turn the patients, to comfort the patients. These are who are at risk, the respiratory therapists, the aid workers, people who aren't making the amount of money that would even be worth the risk. So you know they're doing it out of the goodness of their heart and their desire and their passion for humanity. These are some of the concerns. And hearing about the deaths of the nurses in Southeast Michigan, just the other day, a resident lost his life, 36 or 37-year-old resident who's been going to school his whole life, 3 kids, you know, probably in a lot of debt. And it does put fear in you as a resident, as a provider, as a doctor. You know, a lot of us are separated from our families. I haven't seen my family in over 2 weeks. I have a 6-month-old son. You know, I see him through a door sometimes. But at the same time, it's, you know, it's these concerns is, you know, we're sacrificing, and we hope that we're not the only ones sacrificing, and our government will fight and sacrifice for us as well. So in the healthcare systems, you know, so there's that concern about the appropriate PPE. And even then with reusing masks, being told to reuse masks, another study just came out showing that after 5 times, so when you put on the N95 and you remove it like this, you try not to contaminate it. But after 5 times, because there's a rubber seal or there's the bands on the back, that the seal is not as adequate. So you have that. So other things that we need or we're running out of, you know, the ICUs, they're running out of sedation medication, running out of ventilators, you know, running out of nurses, staff, people getting sick. In my hospital system, 500 nurses are sick in the Beaumont system. So people are getting sick. So 1,500 workers from within Beaumont, 500 nurses. But the one thing that I do appreciate about Beaumont is they do allow us to speak out. I have colleagues at the other systems are not allowed to speak. I know they suggest that we, you know, use their talking points or use their Instagram page, share their information, but no one has ever said anything to me about speaking out. And I've been actually showing the day-to-day life of a resident on a COVID team on my Instagram account. So that's one of the plus. We also have, you know, access, and just today we got another email about, you know, mental health awareness, counselors that we can contact. They brought them to the hospital today. They're always available on the phone. And then as well as being provided childcare for physicians. I'm not sure about nurses, but having that is a privilege. And then you did shed light on something very, very important, and I want to bring it up. We do have some numbers about the rates of death in the African-American community. So 14% of Michigan is, from what I know, 14% is African-American, but 41% of the COVID deaths are African-Americans. So this highlight, the statistic leads you to the question is, why are African-Americans dying at a disproportionate level compared to other populations? And then this question is just on a long list of questions in this country as to why African Americans die on a disproportionate level. And there's many thoughts and reasons, but this is something that, you know, we're gonna have to address as a healthcare system. At this point, you know, we're focused on getting through the mission, we're focused on working, but at the same time, we didn't go into medicine to die, we went into medicine to serve, and we're gonna continue to serve. And we're going to stand together, and, you know, God willing, I hope that we will get through all of this.
Well, thank you so much for the work that you're doing and for, frankly, putting your life on the line every day. And I want to thank Cathy Kennedy for doing the same, and for all of the nurses in National Nurses United. So Cathy Kennedy, a registered nurse and vice president of National Nurses United, is here with us to tell us about the work that you're doing, what you're seeing on the front lines. And then I'd love to hear from you about what National Nurses United is fighting for in terms of safety and health protections for healthcare workers.
All right. Well, thank you very much for having me tonight on Facebook Live. And, you know, I agree with the doctor. I mean, what we're seeing on the ground is exactly what he just described. And what is really, really difficult is these are very, very dangerous working conditions for our registered nurses, as well as all the other healthcare professionals, physicians, respiratory therapists, the nursing assistants, everybody that touches a patient. And so, you know, this risk is really significant, and all we're asking for is to make sure that the nurses and other healthcare professionals have the personal protective equipment that they need to make sure that not only are they safe, but they can provide the care to the patients and not inadvertently expose, you know, the virus to ourselves, to our families, and to our communities. You know, it's really hard what we're seeing in our hospitals, that the management is locking up protective gear. Nurses are having to ask for a mask. A month ago, I mean, it was just a simple mask on an isolation card. We never had the supplies that we needed. And this is really not okay. As the physician was talking about his hospital, he's able to wear an N95 mask. At a lot of the hospitals, we're not allowed to unless you're doing a high-risk procedure such as intubation or any type of aerosol type treatment. And we know, you know, again, the CDC guidelines initially started off saying having the highest standard, but then they downgraded it and saying that it was droplet or contact isolation. As registered nurses, as NNU, we really want to make sure that the nurses and other healthcare workers have the highest level of protection, which is the powered air purified respirators, the PAPR, because those are reusable. N95 mask, absolutely. Face shields, coveralls or gowns, gloves, all those things that are necessary so that as healthcare workers, we're able to go in and provide care, but not contracting the virus ourselves. And this is, the nurses are frustrated, they're scared, they're worried. As the doctor was saying, you know, we have families that we also want to protect. But we also, what we do is, I mean, I've been a nurse for 40 years, and this is something that I've done for the last 40 years, and I'll continue to do it. But if we're not safe, if our hospitals don't provide the equipment that we need to do the job, and we get sick, as you know, the physician mentioned that a lot of healthcare workers are ill, who's going to provide care for the patients? Who's going to handle and manage the ventilators, do the respiratory treatments? Because all of the healthcare workers are either sick or unfortunately have died. You know, one death is too many. One death is too many. You know, we have hospital managers threatening nurses that if they put on an N95, that they would be disciplined. That's ridiculous. You know, that's just not necessary. And then to have nurses reuse N95, doctor was talking about that. What we were told is that, you know, you can use a mask, reuse it. If it's an N95, you disinfect it, put it in a brown paper bag, better yet, hang it on an IV pole, and then turn around and come back and use it again. How ridiculous is that? Mm-hmm. We've already infected ourselves, you know, so this is really unconscionable. So what are the nurses doing? We're fighting back all across the United States. We're really letting the managers in the hospitals know that this is not okay, that everyone's life matters. And so we really, we do silent protests. A bandana is not an effective way to protect the nurse, you know, so we're saying we need personal protective equipment and we need it now. You know, they're hoarding it. We know that. We know that it's available. And, you know, we really feel that it is something that we can continue to put pressure on Congress and to ensure that there's a federal OSHA standard to have an emergency standard to protect nurses and other healthcare workers during this crisis. And that's to say, provide everyone with the highest level of protection, like I mentioned before. And then also to get President Trump to invoke the Defense Protection Act, something that he can do. And I'm sure Congressman Levin will talk about that. But it's so important because we can't have our healthcare workers sick. We can't have people scared. You know, we have work to do. You know, I became a nurse 40 years ago, and it is what I love to do, what I do every day. But I want to make sure that everyone is safe. I don't want to see nurses crying. I don't want to see them quit. This is a fight that's worth fighting for, and we are going to be successful. And it's really important that Congress and the president hear what the nurses and other healthcare workers are saying.
Mm-hmm. Well, thank you so much for standing up and fighting on behalf of healthcare workers everywhere. I want to echo one of the things that you just said that I think is so powerful and important, which is if we don't fix this problem, if we don't make sure that our nurses and doctors and other healthcare workers have what they need to stay safe, we're going to have a healthcare worker shortage. I mean, that's where this is going. And we saw in Spain, there was a count I saw last week that 12% of the folks who were infected were healthcare workers in Spain, right? I mean, this affects all of us. There are so many ways in which the coronavirus pandemic has taught us that we're all in this together. And this is one in particular. Congressman Levin, I want to turn to you. I know you've been fighting to make sure that the president invokes the Defense Production Act and actually uses it, and not just invokes it, but actually uses it to deliver what folks need. And also fought for the CARES Act and the billions of dollars in there that I'm sure you'll talk about that went to support these needs. But first, can we talk about Michigan for a second and how folks in Michigan and in your district are doing? I know that you've been one of the hardest hit areas, hardest hit states, and would just like to hear how you're doing and how your constituents are doing. And thank you for joining us and for all you're doing in the fight.
Well, thanks so much, Liz. First, let me say what a crucial role the CPC Center is playing in bringing people together to fight for justice in this country. So it's an honor to be with you and all the folks gathered here. My brother, Dr. Nasrallah, I see in the little window next to me, he's in a neighboring county in Wayne County. I represent significant parts of Oakland and Macomb counties. And we are in flat out crisis. There are hundreds and hundreds of people in his system, the Beaumont system, who've tested positive. 700, it was announced last night, 700 people in the Henry Ford health system. This is employees. This is completely unnecessary. Would there be some nurses and doctors and techs and so forth infected no matter what? Yes. But in other countries that are doing an adequate job of protecting their frontline workers, you know, Spain has had a lot of trouble too, but in other countries that have done a good job of this and been well prepared, there haven't been anything like the number of infected and even dying frontline healthcare workers. And the stories are legion from across my district and across Southeast Michigan. One hospital, doctors can have N95s and nurses can't. Another hospital, you use even a surgical mask, you have to use it all week unless it's one surgical mask, the little, you know, not the N95s, the little kind, unless it's soiled or torn. Reuse of equipment is rampant. We had a pulmonologist in his 70s who's been practicing for 40 or 50 years say he's never been disrespected like he feels now because he's expected, obviously he's at risk, he's 74 years old, but he's expected to go into these rooms. What do we need more than a pulmonologist? I mean, the, you know, along with the nurses and techs who specialize in taking care of people with lung disease, these are the absolute central people. It's insane for us to be endangering our nurses and doctors and other frontline health workers, yet that's exactly what we're doing. And why? This crisis, the biggest public health crisis in 100 years, is exposing some things about our society. Number one, our complete disinvestment in our public health system. The Trump is guilty of doing it recently, getting rid of the National Security Council office, the funding, the staff that dealt with pandemics, resisting funding for pandemic preparedness and so forth. But we've been doing it as a society for a long time. Secondly, the lack of a national health system. Medicare for all, call it what you want. We in our first bill, we had to say that you know, everybody should come in and get tested, and no one should pay for it. We tried to get free treatment and vaccines in this bill, but we're going to have to fight on for that. Just imagine if we had national health care. For one thing, we could move the equipment around as we needed to the hotspots. For another thing, we wouldn't be worried that people would refuse to get tested or treated and therefore continue to spread the disease because they can't afford to get tested or because they don't have any health coverage. So we've exposed that too. And thirdly, what Dr. Nasrallah mentioned, the structural racism in our society. We're seeing it in Metro Detroit, where African Americans are way more likely to be infected, way more likely to die because of COVID, you know, of this COVID-19 pandemic. So these things are being exposed. You wanted me to mention what we've done, you know, in the CARES Act on this question of PPEs. We included $4.3 billion for the Centers for Disease Control and Prevention to support federal, state, and local public health agencies to prevent and prepare for and respond to the coronavirus crisis. We gave $100 billion of relief to hospitals and other providers for a new program to provide grants to hospitals and other providers, and Medicare and Medicaid enrolled suppliers and institutional providers to cover unreimbursed healthcare. This should help with this question. $16 billion for the Strategic National Stockpile to stock up on these critical medical supplies, and $1 billion for the Defense Production Act. But I just want to tell you that people are in this situation, way more frontline workers exposed, way more people infected, and way more people dying because this president refuses to use the powers that he already has at his disposal under the Defense Production Act. It's called the Defense Production Act, but it gives him the power to analyze everything we should have and need for testing, everything about testing, everything about procurement and production, and everything about distribution. And he has the power to figure out how many N95s we need, how many gowns, how many gloves, how many swabs, everything. What do we have available? What can we get on the world market? What do we need to produce and then distribute it around to where it's needed most? He's not using any of that. He's treating the Defense Production Act as some little power, you know, way to attack individual companies and do ridiculous things like that. The DPA is not about nationalizing industry. The predecessor of the Defense Production Act in World War II is what allowed us to create the arsenal of democracy and win that war. The companies that stopped making cars and started making bombers and tanks weren't nationalized. We gave them guaranteed government contracts to keep the companies afloat, keep people working. Hello, what do we need right now? And produce what we needed. And that's what he should be doing now. So it's just a, you know, we've known that Donald Trump was a disaster all this time. Now this crisis has truly shown, you know, the whole world what he is. He's completely overmatched by this He's not leading. And, you know, we're just going to have to make the best of it. I do want to close by saying I've been so inspired by nurses like Cathy, doctors like Ali, who are out here on the front lines. You know, I'm a lifelong peacenik, so sorry, I'm going to use a war analogy. We are at war with this virus, and these are soldiers marching into battle. And God damn it, when we send soldiers into war, we are so proud as Americans. They're like, they have the best, you know, materials, weapons, everything they need. And what a shame on us that we're sending our frontline soldiers into this battle without the equipment they need to keep themselves safe, therefore making it harder for us to succeed, because when our nurses and doctors go down, as people have said, we're less able to take care of people, and we're shooting ourselves in the foot. So I'm really inspired by all the workers who are out there taking care of us regardless, by the companies and the workers that have stepped up. So many unions are up there fighting. Postal workers are fighting for postal workers who don't have what they need. It was the UAW members who forced the big three to shut down. And, you know, so many workers are out there on the front lines fighting for safety for all workers in this situation. And we're just going to have to come together as a progressive community and fight for justice and fight to deal with this pandemic as best we can, with this huge albatross around our neck called Donald Trump.
Mm-hmm. Well, thank you, Congressman, for leading the charge and for fighting every single day, and for really understanding and being so eloquent in Washington on behalf of folks across the country. And we really need you, and we appreciate you. And I know you're just working probably 24/7, and thanks for being on this particular call with us. I want to turn now to Dr. Sanjeev Sriram, who is with us here tonight, and ask Dr. Sriram to talk a little bit about a project that he is working on, which is Masks for America. Masks for America is an effort to get the N95 masks that folks need into hospitals, and we're so honored to have Dr. Sriram on, and thankful for his advocacy. Of course, what we really need to do is have a government that will actually make sure that the folks who are going into war, I mean, it's a war against the coronavirus, and the coronavirus is our enemy. And as in World War II, when FDR made sure that that folks had what they needed abroad and at home, that is what our president needs to do. But in the absence of that, we're seeing folks like Dr. Sriram step up, and I'm hoping, Dr. Sriram, you'll join us and talk about what you're working on.
Yeah, hi, thanks so much for having me on this call, and I appreciate everything that's been said so far. I think that in moments like this, what I've found so inspiring about these kinds of conversations is the solidarity that we have with each other as healthcare workers, as members of Congress who have our backs in those halls of power. It means so much to, have time like this where, healthcare workers can feel like they're not alone, that they're being heard, that their pain is not something to be suffered in isolation, that we're going to get through this together and fight it out. So Masks for America started as literally I got a phone call from an activist friend who said, hey, it was Kristen Ming. She gave me a call and said, hey, do you have time to talk to Bob Bland about a project that we want to do, and it's about getting masks to frontline workers. And I immediately was like, I'm in. Whatever it is you guys want to do, I'm in, because I've admired the hard work of these activists before. We've protested together, we've rallied together, we've organized together. And so when I got the call, I was automatically in. And what Mask for America is it's a project run by this small, intrepid team of grassroots volunteers. We're putting together our respective skills to get N95 equivalent masks to every healthcare worker in the United States and Puerto Rico. And we are partnered with an FDA certified manufacturer selling KN95 masks. These masks are being sold at only $2 a mask. It is a fraction of what hospitals and governments have been paying for N95 masks. And the KN95 has been approved as an equivalent to the N95 for use against the coronavirus. What people need to understand about this fundraiser is that every cent of every dollar donated goes directly to the manufacturing and distribution of masks. We're sending masks to healthcare facilities when they request them through getusppe.org. And for viewers of this event, if you go to masks4america.org, you can donate and be part of this project to make sure that that healthcare workers are getting the masks that they need. Every person, including the broker, is volunteering their time. So the entirety of your tax-deductible donation is dedicated to providing safe, high-quality masks to our frontline healthcare workers. And this is a project that is literally less than 10 days old. I mean, we're really just blown away by the amount of support that we've gotten so far. Masks4america.org is, we got started on GoFundMe, and we're at $110,000 in less than 10 days because people, even during these desperate times, are giving what they can. Mm-hmm. And it's been really humbling to see people who, despite economic hardship, despite the peril of this pandemic, are still finding it in their hearts and in their wallets to give, and it means so much. What we keep reminding ourselves at Masks for America is that we shouldn't have to be doing this, right? Like, this isn't the kind of project that the wealthiest country in the world, in the history of mankind, should be putting people through. And the fact that we had to go to GoFundMe, I think, is actually pretty telling of our healthcare system, because, over 1 in 3 GoFundMe pages, even before the pandemic, was being used to pay for medical bills. And so it's, I feel that as we continue to fight the coronavirus, I'm so glad to hear Dr. Nasrallah and Nurse Kennedy and Congressman Levin talk about the way that we need to look at what has been so broken and busted in this system, that it is hurting patients, it's hurting providers, and that we can't come out of this thinking that we're going to go back to quote unquote normal ever again, because this is simply not the way that we should be fighting a pandemic in the richest country on earth in the history of mankind. I appreciate everybody going to masks4america.org and donating what they can. If you are a healthcare facility that wants to get in touch with us about placing an order, go to getusppe.org. Feel free to try to contact us via Facebook and Twitter. We've left our DMs open so that people can get in touch with us about what they need, and we are constantly trying to connect people to these high quality masks and save as many people as we can.
Thank you, Dr. Sriram, and thank you for your generosity in doing this on top of your day job and the activism that you already did, fighting to make sure that every single one of us has guaranteed healthcare in America. So you are an amazing, amazing human. I want to read a couple of the questions that have come in for us, and we only have a few more minutes together. Janine from New York, this is a comment. She says, I'm a frontline healthcare worker, and we need PPE supplies right now. She wants you to know that she's been reusing isolation gowns between patients and between staff days upon days, and that this effort tonight that we're talking about to put an end to that is so important. She says, we're reusing N95 masks for a week. We're going into positive rooms more because not enough N95 masks for the lab, housekeeping, dietary, etc. So nursing staff has repeat exposure with added duties because of lack of protective equipment. So thank you all for being in the fight, and thank you, Congressman, for the work you're doing to put an end to that. I want to also read a question from a home healthcare worker that I might tee up for you, Congressman, Jessica from Pennsylvania. So Jessica from Pennsylvania, I'm sorry, she's a client. So she says, our home healthcare workers need gloves and masks and to be treated with dignity, such as making at least $15 an hour rather than $11.20, which nobody can live on. My aide has never missed a day in the 2 years that she has taken care of me, 8 hours a day, 5 days a week. And without her care, I would be in a nursing home or I wouldn't have survived. I'm in the highest risk group for getting COVID-19. And I want to know what you're going to do for the home healthcare worker who is taking care of me and keeping me safe. Congressman?
Well, thank you, Liz. Jessica, that's a great and really important question. First of all, we need to pass what we called the Raise the Wage Act, which we passed through the House, which I was so proud to be a whip for. Through the Raise the Wage Act, we would have a national minimum wage of $15 an hour by 2025 with no sub-minimum wages. So tipped workers who are overwhelmingly women and of color would no longer get these sub-minimums, no sub-minimums for kids or people with disabilities. Everybody would have the dignity of being able to make $15 an hour. In terms of PPEs, the point you make is so important. Today, we're focused on hospital workers because we have to, because they are the very most at risk. But what we've been working on in Congress is that we need safety for home healthcare workers, like your aides, for postal workers, for people who handle packages, grocery workers, people in the food distribution system, and so forth. I helped write and introduce a bill to demand that OSHA create an emergency standard to protect healthcare workers in this crisis. That bill was included in the House version of the CARES Act, and we are going to fight for it in the next package so that your aides are protected. They need to be. And all these frontline workers need to be. And, you know, it's just, someone mentioned we're the, you know, richest country in the world, and the idea that we're not protecting our workers is, you know, a national shame and a scandal, and something that we're going to fight for. Liz, let me just mention one other thing that we're doing. This isn't just me. So many members of Congress have turned into something that we're not qualified to be, and we never expected to be, which is sort of like independent contracting coordinators. We are fielding calls, making calls, connecting people who say they have access to any of this stuff anywhere in the world or that can produce it, to try to get materials for our frontline workers. The idea that we are doing that is so ridiculous because it's inefficient. And we should be doing it, you know, the president should be doing it through the Defense Production Act. I also want to give a shout out to some of our governors who are doing such a great job of trying to protect their citizens and their workers. Governor Whitmer in my state and other governors. But, you know, again, it doesn't make any sense to do it ad hoc like this. We should be doing it on a national basis. So we're gonna get protection for your aides by hook or by crook. And thanks for writing in or whatever you did.
One of our commenters, thank you, Congressman, has asked me to mention to all of you here today that a group of healthcare providers, including Dr. Sriram, who's on this call, and nurses from NNU, have a letter that is a letter from healthcare providers, an open letter to Donald Trump. It's signed by more than 1,000 healthcare providers, calling on President Trump to keep our healthcare workers and our frontline workers safe. And if you are a healthcare worker and you want to sign this letter, this 1,000-person strong letter, and make it 1,001 and 2 and 3, we would love that. And we're going to drop that into the chat. I'm going to ask one more question of Congressman Levin, and the question comes from Bob Borisaj, and it's a question about what we can expect to see next. out of the House of Representatives in terms of leadership on a phase 4 package, and what might happen in the House versus in the Senate.
Well, I just saw in the chat section that Bob had asked whether whether we will go first. That is one of my most fervent priorities. We, in the 3 bills that we've done so far, the first and the second one, the president has no policy proposals. He was talking about a payroll tax cut. So really the House completely drove the discussion. And then the speaker had to do some negotiation with Secretary Mnuchin. In the third one, the Senate was still in session and the House had gone out of session. And because of this unusual crisis, people were out of town. And we were reacting to a horrible Senate proposal. We made it so much better, but it's not the way to go to be reacting to them. So we really need to go first and come up with the phase 4 proposal. And let me just mention a few things that I think need to be in it. Number one, we have to have racial and economic justice, consciousness, sensibility throughout the whole thing. Number two, we need cost-free treatment, cost-free vaccines. We are fighting the progressives are fighting for Medicare coverage for everyone who loses their job and loses their health care. We certainly need more Medicaid funding for the states. We got $6.2 billion for FMAP through this CARES Act, but that's not enough and we'll need more. There ought to be a special ACA enrollment period for people who lose their jobs. That's another proposal that is sort of less preferable to letting people get on Medicare, but it's another possibility that might end up surviving. As I mentioned before, we need an emergency OSHA standard for healthcare workers, our hospital workers and others. Something we haven't talked about that much on this call, there's way more to talk about than we can. We've got to test and trace on a mass scale, including people who are not symptomatic. Mm-hmm. As Dr. Nasrallah mentioned, we've learned so much as we've gone along. Humility is in very short supply in our administration that we have right now. But as we learn, we realize that other countries are doing so much better a job at preventing mass spread of the disease because they are testing and tracing, and we need to do that on a mass scale. We probably need a huge workforce program to get people up to speed to work with our county health departments, and that's another great way to sort of deal with some of our original sins of racism by making sure that the people trained to do that work are truly representative of their communities. So those are some of the things tied to what we're talking about here that need to be in the package. There are other broader things like educational justice matters, access for kids who don't have devices and internet access, and a lot of other broader things that we need. But those are some of the things tied to healthcare workers, PPEs, and healthcare access for people that we need to have in a next package. And that's what we're fighting for.
Thank you, Congressman, and thank you again for leading the charge for a recovery that is really equitable and centers racial justice and make sure that we put people first and not CEOs and shareholders. We need you in that fight in Washington. I want to thank everyone who joined this call tonight, and especially our frontline healthcare workers who are out there every day serving patients and keeping us safe. We need to be keeping you safe, and that's what we're all here tonight fighting for, and we're going to keep fighting together to get that done, and we need to get it done yesterday. So thank you to Vice President Cathy Kennedy of NNU, to Dr. Ali Nasrallah for joining us from his COVID-19 Center and really giving us a view from the front lines, to Dr. Sriram for being with us and telling us about the important effort around Masks for America and why what we are seeing now is really how much worse this pandemic is made by our broken healthcare system, and how we need to guarantee healthcare coverage to every single person in this great nation of ours. Thank you, Congressman Levin, for being in the fight on all of the priorities that we need to make happen in order to make this, our response to the crisis actually fit the scale of the problem. So I want to thank everyone who took time out of their evening to join us here tonight. If you got on late, just hop on over to the Congressional Progressive Caucus Center's Facebook page and you can go ahead and watch the rest of it. We are thrilled to be here with you. We're doing these on about a weekly basis. And when I think about what keeps me going in these very, very difficult times that we're living through, it is the spirit and the courage of the people on this call and the folks across the country who realize that we're all in this together and who are fighting for each other. So thank you so much for what all of you do, and please keep up the fight. Good night, everyone.
Thank you. Good night.